Could the wrong eardrop put a patient's hearing at risk? What should you ask before recommending treatments for swimmer's ear? Welcome to Clinical Capsules from TRC Healthcare, your trusted source for practical, evidence-based updates. On this episode, assistant editor and clinical pharmacist Gina Corley reviews practical swimmer's ear treatment considerations for healthcare teams, including how ear tubes and eardrum status affects which otic drops are appropriate. An excerpt from our popular Pharmacy Essential Updates webinar series. This podcast offers continuing education credit for pharmacists and pharmacy technicians. Please log into your pharmacist letter or pharmacy technician's letter account and look for the title of this podcast in the list of available CE courses. None of the speakers have anything to disclose. Catch new episodes of Clinical Capsules every second and fourth Tuesday, bringing concise, actionable insights from TRC experts straight to your ears. With that, let's listen in.
So today we'll go through what swimmer's ear is, what types of medications you can expect to see, certain caveats for prescribing these medications, and some practice pearls at the end. All right, let's jump in. So swimmer's ear is an infection in the outer ear canal, which is why we'll sometimes hear this infection called acute otitis externa. The outer ear is the part that runs from the eardrum to the outside of the head. Swimmer's ear tends to happen when excess water gets trapped in the ear canal, since the excess moisture creates an optimal environment for bacteria to grow. The two types of bacteria that most often cause swimmer's ear are Pseudomonas aeruginosa and Staphylococcus aureus. So keep in mind that when we talk about treatments, the preferred meds are the ones that will cover against these bugs. And just as an FYI, sometimes swimmer's ear can be a fungal infection instead of a bacterial infection, but this is less common. And then as far as symptoms, you'll often hear patients that get swimmer's ear complain of pain, itchiness, or a feeling of fullness in the ear due to all the water trapped inside. So when it comes to medications, topical antibiotic eardrops are typically first line. These work best because they deliver the medication directly to the site of infection. Some of these topical antibiotics come combined with a steroid, which may relieve pain a day sooner. We normally want to avoid systemic antibiotics in swimmer's ear because they can produce more side effects and are typically much less effective than topicals. Exceptions to this would be if the infection spreads beyond the ear or if the patient has risk factors for necrotizing otitis, which is a severe and sometimes fatal infection that spreads from the outer ear canal into the skull bones. Patients at high risk for this typically include elderly patients with diabetes or those who are immunocompromised. Now, when it comes to treatment, we want to base our choice on eardrum status, cost, dosing frequency, and convenience, since one eardrop has not been shown to be better than another. But before we explore the individual meds, let's take a closer look at what we mean by eardrum status. So one of the things that we want to ask when patients are getting eardrops is if they have a perforated or ruptured eardrum, or if they have ear tubes. And this is because we want to avoid eardrops that are non-sterile or ototoxic in these patients. Patients with a ruptured eardrum, also called a perforated tympanic membrane, essentially have a hole in their ear. So non-sterile or ototoxic medications can easily get down into the middle and inner part of the ear and cause things like permanent hearing loss, chronic middle ear irritation, and secondary infections. And of course, this is also a risk if someone has ear tubes, since these tubes are placed directly into the eardrum. So, just as a quick summary, when we hear about an eardrop being ototoxic, this essentially means it's toxic or harmful if it gets into the middle part of the ear. But it's fine to put these drops along with non sterile eardrops in the outer ear canal. All right, so now let's take a look at some of the more common products out there for swimmer's ear. These include acetic acid with hydrocortisone, ciprofloxacin, ciprofloxacin with dexamethasone, ciprofloxacin with hydrocortisone, neomycin, polymyxin B, and hydrocortisone, and ofloxacin. Most of these products are usually used for 7 days, but neomycin, polymyxin B, and hydrocortisone drops can be used for up to 10 days. So now let's explore the various options. You'll see that many of them involve a quinolone antibiotic, so like plain ciprofloxacin or ofloxacin. Or these can be combined with a steroid, like I mentioned. So we have ciprofloxacin with dexamethasone or ciprofloxacin with hydrocortisone as a couple examples. But one important distinction that I want to point out here is that ciprofloxacin with dexamethasone is fine to use in patients with a perforated eardrum or ear tubes. But ciprofloxacin with hydrocortisone is not sterile and therefore should be avoided in these patients. Another antibiotic combo drop that we have is neomycin, polymyxin B, and hydrocortisone or cortisporin. But this one should also be avoided in patients with a perforated eardrum or ear tubes. And this is partially because neomycin, which is an aminoglycoside antibiotic, can cause hearing loss and also damage the hair cells of the inner ear. The other reason is because this combo has high acidity and can cause burning and stinging, which hurts much worse if it gets into the sensitive tissues of the inner ear. Another caveat with cortisporin is that it comes as a suspension and a solution. And this suspension is often preferred due to it being less irritating. And then I also wanted to mention that acetic acid eardrops can be used since acetic acid has antimicrobial properties. But these drops are ototoxic and non-sterile, so we can't give these to patients with a ruptured eardrum or ear tubes either. In terms of cost, eardrops with a steroid are sometimes a bit more costly than plain antibiotic eardrops. So if cost is a major concern, we can suggest ofloxacin 0.3% eardrops since these are under $30 per bottle. Or another option is to use eye drops in the ear. All right, so let's talk a little more about using eye drops in the ear. Most eye drops can be used in the ear because they're manufactured to be extremely sterile and have a more stable pH balance. And of course, this is because eye tissue is a lot more sensitive than ear tissue. But we always want to keep in mind that the reverse is not true, and eardrops should never be used in the eye. So it's important to really pay attention when we get prescriptions for both eye and ear products. For one thing, these meds have similar packaging, and so it's easy to grab the wrong one. But another big reason is that the same antibiotic can be manufactured as an eye drop and as an eardrop. So, for instance, ofloxacin comes as a 0.3% ophthalmic solution and a 0.3% otic solution. So, why would we want to use eye meds in the ear? Well, like I said, a big reason is often cost, since eye drops sometimes tend to cost less than eardrops. For instance, ciprofloxacin 0.2% eardrops cost over $100 per box, whereas ciprofloxacin 0.3% eye drops cost less than $25 per bottle. So this is one scenario that if the prescriber wanted to use ciprofloxacin, that they could prescribe the eye drops instead of the eardrops. If patients also need something for pain, we can recommend adding oral acetaminophen or an NSAID such as ibuprofen. These are typically only used for the first 48 to 72 hours of the infection, since patients should start to get relief from their topical treatment within this time frame. Suggest scheduled doses of these analgesics, since this may control severe pain better than using them as needed. However, we typically want to discourage eardrops for pain. OTCs such as Ear Pain MD that contain lidocaine may provide temporary pain relief, but they may also mask symptoms of a worsening infection. And then other drops such as sweet oil or Highland's earache drops aren't likely to help. Plus, these drops should also be avoided in patients with ear tubes or a perforated eardrum because most are not sterile. And then real quick, I wanted to touch on a couple things we want to avoid when it comes to treating swimmer's ear. First, we want to discourage home remedy treatments such as isopropyl alcohol mixed with white vinegar, since these have no evidence of benefit. And then we also want to tell patients to avoid ear candles because these can actually cause harm and lead to things like hearing loss and tympanic membrane perforation. So now that we know how to treat swimmer's ear, let's talk about how to prevent it. For starters, patients can use earplugs or ear protection headbands such as neoprene or ear bandit while swimming to help keep water out of the ear. However, some data show that earplugs may irritate the ear canal. So if this happens, we can always suggest another option. Patients can also try OTC isopropyl alcohol drops such as Swim Ear or Debrox after swimming to help dry out the ear canal. I know we just said not to use isopropyl alcohol mixtures for treatment, but it may help with prevention. Another option is to use a hairdryer on the lowest setting, several inches from the ear, to dry the ears after water exposure. Patients can also apply acetic acid drops after the ears are dry, and these work by lowering the pH of the ear canal, which creates a more unfavorable environment for bacteria to thrive. All right, now let's go over some practice pearls when it comes to swimmer's ear. As we mentioned in the treatment section, many meds have similar ingredients or names. So stay alert for mix-ups, such as between Ciprodex, Cipro-HC, and ciprofloxacin ear or eye drops. Next, we want to ensure we're using the right drops per ml conversion factor when calculating days supply. Many pharmacies or payers use 20 drops per ml, but some use 15 to 16 drops per ml, depending on the med. And using the wrong one could lead to chargebacks. We also want to include a for the ear label on drops for swimmer's ear, especially when eye drops are being used in the ear. And then we want to let patients know that swimming should be avoided during treatment, so the infection does not get worse. But competitive swimmers can sometimes return to the pool sooner, around 2 to 3 days after pain has resolved. They'll just want to make sure that they use well-fitting earplugs. All right, so lastly, let's go over how to properly administer eardrops. We want to start by telling patients to warm the bottle in their hands, which can help offset any discomfort if the drops happen to be a little cool. Next, we want to have patients lie down with their affected ear facing up. For adults, we can tell them to pull the upper part of the ear up and back. And for kids, we can suggest pulling the lower part of the ear down and back. This helps to straighten out the ear canal. After that, patients will apply the correct number of drops into the ear and massage the tragus area, which is the small flap of cartilage sticking up right next to the face. This can help the eardrops really soak into the ear. Ideally, patients will want to stay with their head in this position for about 5 minutes, and then the ear can drain and dry naturally.
Thanks for listening. We hope today's episode gave you practical insights you can use right away. Now that you've listened, pharmacists and pharmacy technicians can receive CE credit. Just log into your pharmacist letter or pharmacy technician's letter account and look for the title of this podcast in the list of available CE courses. We've linked the resources we mentioned and more on today's topic right in the show notes. Those links will take you straight to our websites where you'll find even more concise, evidence-based charts, articles, and tools. If you're not yet a subscriber, now's the time. Sign up today to stay ahead with trusted, unbiased insights and continuing education. Listeners save 10% on a new or upgraded subscription. Just use code CC1026 at checkout. Looking for more? Explore our other TRC podcasts like Medication Talk, Rumor vs. Truth, and Natural Medicines, Evidence and Practice. Or dive deeper with our full Pharmacy Essential Updates webinar series. If you found this episode helpful, follow Clinical Capsules or leave a quick rating or review. It helps others discover the show. Even better, share what you learned with a friend or a colleague and let them know they can find the show on any podcast app or on YouTube. Have a question or a topic suggestion? Reach out using the Send Us Fan Mail link in the show notes or email contact@trchealthcare.com. Your perspective matters. Share your thoughts anytime to help shape future episodes. Thanks for listening. Stay sharp, stay current, and join us next time on Clinical Capsules.